I'm Christopher Schoenwald, and welcome to Life as a show intently focused on helping people find their professional pathway by exploring and unearthing the details of jobs from around the world. Before we get into today's episode, I just want to throw this out there. I have a channel over on YouTube, Life as a ... which basically hosts highlights from these audio conversations that I have with these great guests. They typically run 10 to 15 minutes, and they're there to kind of present a different vantage point. You know, for people that aren't into audio, aren't into podcasts, but are still looking for career advice, ideas, help, all that great stuff, send them over to YouTube. Like I said, Life as a ... And if you do get over there, I would love that like or subscribe. I mean, it's the best way to let that algorithm know that the content is worth sharing and should be out there. So anyway, I do thank you for letting me plug this a little bit, but I think it's about time to get into today's episode. Today, I'd like to lead into this episode with a bit of a hot take. Now, what I'm about to share may not be embraced by all. However, all the same, I'll share it anyways. You ready? All right, well, here goes. The field of plastic surgery is the most misunderstood specialty within the medical field, bar none. Now, let's try this out on you. I mean, when you hear plastic surgery, what's the first thing that comes to mind? For me, it was duck lips, certain Instagram influencers, and this massive obsession people all around the world have for this idea of beauty and the preservation of it. However, to quote a guest, a respected plastic surgeon you'll soon hear from, that's not it. That is not it. Now, in this episode, we dive into the truths of what it means to be an actual plastic surgeon. Now, does some of this work involve talk of aesthetic medicine and surgery? Sure, but there is this whole other side that we get into too. Plus, you'll hear a lot more. For example, how our guest feels there are two types of plastic surgeons and how most are usually one or the other. You'll also get insights on why being a plastic surgeon can be so rewarding. And you'll even hear why our guest listens to the musical artist Adele when in the operating room. We'll be covering this and a lot more, so stick around. All right, well, let me introduce you to our guest and we can get rocking. Many would consider plastic surgeon Dr. Halperin Ben Ami to be an innovator within the realm of reconstructive surgery. At Emek Medical Center in Afula, Israel, she contributes her expertise towards the blend of cutting-edge science with a holistic understanding of each individual and patient of hers. Dr. Halperin Ben Ami is part of the fellowship of the International Society of Aesthetic Plastic Surgery, or ISAPS, which is the world's leading professional body for board-certified aesthetic plastic surgeons. Now, she brings a wealth of specialized knowledge and international collaboration to her work, continuously pushing the boundaries of aesthetic and reconstructive surgery. Now, she's also a firm believer that strong is the new beautiful, advocating for the celebration of diverse body types and beauty standards in all her work. And finally, Dr. Halperin Ben Ami is an award-winning educator recognized for her passion in teaching, awarded Best Lecturer Prize in 2018 at the Technion Medical Faculty in Haifa, Israel, inspiring the next generation of medical professionals. So with all of this noted, love to welcome you to my conversation with Dr. Halperin Ben Ami. Yeah, so welcome to the program. How are you doing today?
Fine, thank you. Happy to be here.
Yeah, absolutely. I mean, as we were just speaking before we got this recording going, I had an excellent conversation with one of your friends. And for listeners who want to keep tabs, May Brooks Kempler, a cybersecurity expert, who spoke very highly of you, and really excited to have you on the program here today.
Yeah, our love is mutual.
Well, with all of that in mind, I mean, I would like to get started here, and I do have the first segment lined up for us here tomorrow. It's something called Coloring Wikipedia. In this segment, I just read off a definition from Wikipedia, something that relates to what the guest is all about. Now, surprise, surprise, I went with plastic surgery for you. And maybe after I'm done reading this, you could share some comments. Does this sound okay?
Okay.
All right, here we go. Plastic surgery. Plastic surgery is a surgical specialty involving the restoration, reconstruction, or alteration of the human body. It can be divided into two main categories: reconstructive surgery and cosmetic surgery. Reconstructive surgery focuses on restoring a body part or improving its function. In contrast, cosmetic or aesthetic surgery focuses solely on improving the physical appearance of the body. Now, although this definition is rather simplistic, most people have an idea of what plastic surgery is. That's not the point of the segment. But what I'm curious is to hear from somebody such as yourself who is involved in this day in and day out. Like, what's your take on that definition? Is there something that's missing or could be emphasized further? What's your first take on that?
I think it's too simplistic.
Mm.
Like when you're trying to understand what's white and what's black, it's not. It sounds almost like it's a two-sided specialty, and it's not. Basically, aesthetic surgery, the way I see it, is not merely improving the appearance of our patients. I do believe it is a kind of reconstructive work because we reconstruct the outer appearance of our patients so it could be better adjusted to how they feel inside. It's also a very powerful tool which allows us to help our patients. We help them feel more complete, to be more confident about themselves. And I do believe that what we learn as plastic surgeons in our aesthetic part of our specialty, it's also what makes us very good reconstructors because just the reconstruction of a function of an organ or a tissue, it's not enough. These days, it's not enough. Our patients need to be whole again. It's not a different speciality. It's the same one. That's my take, at least.
Yeah, I like that. I like that right out of the gate here. I mean, that idea of it being transformative in a lot of different ways. I mean, from the physical standpoint, obviously, but then also that point that you
Yeah,
raise of like how it affects a person inside, mentally speaking, as well, and bringing
yeah.
maybe a different sense of joy or satisfaction with themselves, which then kind of translates how they interact with the world. And that sort of transformation is also embedded within this, I would think. Just at least that's what I'm sort of picking up from what you shared there.
Yeah, it's about how a person appreciates themselves and how they walk this earth, with what feeling they wake up in the morning. And it's their self confidence. If they are confident, they can achieve almost anything. That's our goal. We don't need to create a world of Barbie dolls and Kens. We're just trying to make people's lives better, make them feel whole.
Yeah. Now, I did mention your background to listeners off the top of the show, but maybe this might be an
Mhm.
opportune time to hear a little bit more about your work from you. Maybe you could fill in some of the blanks for us.
I am a reconstructive surgeon. I work in the hospital near where I live in Israel in the north. And mostly I do reconstructive work for face, either treating skin cancer. We have a lot of cases here because it's a very sunny weather and very light complexion patients living out here in the sun. So this is one, and I love it very much. But my heart goes out to the reconstructive work I do for my breast patients. We have a lot of breast cancer and breast cancer related reconstruction and a lot of additive operations that we do after the reconstruction, like fat grafting and scar tissues remodeling. So my heart really is there with, I call them my girls. I love my girls because it's a very special connection that you get to have with your patients. It's a very fragile moment during their lives. And I think that sometimes a woman needs another woman to understand the complexities of the situation. So this is one. And that's what I do mostly during the mornings. In the afternoon, I do more of aesthetic work, aesthetic medicine, and aesthetic surgery. I'm a big fan of body surgery, also breast, but abdomen, liposuction. I love my injectables, my lasers. I really do enjoy the whole 360 degrees of my profession. I really like it.
Are you involved in performing procedures on a daily basis, or is this?
It varies. Some of the week I operate every day. Some of them it depends if I'm doing minor surgeries like excisions and stuff like that, or biopsies, or if it's a big surgery like breast reconstruction, like abdominoplasty, breast reduction. Normally, those don't happen every day. They happen like once or twice a week. but minor surgeries can happen on a daily basis.
Okay, this might be a bit of a silly question, but what would a day look like when you're not involved in any procedures? What would be taking up your time on those particular days?
If we begin in the morning, I have beautiful three kids that I need to get them to school. So that my morning is a little hectic, very playful. We're a fun family. Yeah, by 8 in the morning, everybody's out, and we're out. We need to meet the day. So basically, the morning could be counseling in the hospital, in the clinic, the hospital's clinic, where we get to see patients before and after surgery. We can consult on scars, hypertrophic scars, keloid scars, wound treatment, a lot of chronic wounds that we treat, and burns, major burns. They come into the plastic surgery department, and we see them ambulatory in the clinic. So that would be until midday or early afternoon. And a day like that afterwards, normally you go to your private clinic to see your private patients because you can't see them in the hospital. So private practice is also post-op, pre-op consultations. I do a lot of aesthetic injectables, botulinum toxin and hyaluronic acid, fillers, thread lifting sometimes. It's busy. I'm keeping busy.
Yeah, it sounds like it.
Yeah.
Yeah, this question here as well. I mean, when you were getting into this field and when you were just starting, I'm sure you had some preconceived notions of what it would be like just based off of your studies, perhaps, and whatnot. But was there anything that once you actually entered the field, you realized this aspect of the job is a lot bigger than what you'd ever imagined it to have been or what you perceived it perhaps to be? Was there anything there that sort of surprised you once you got going?
Yeah, I have to say that my first encounter with plastic surgery was during my fourth year in med school. I went to medical school in Italy, in the north of Italy, and I remember going into the plastic surgery clinic, and I was terrified. I saw the burns and major surgeries and reconstructions, and I was terrified. I remember going home and telling my well, then he was my boyfriend. Then now he's my husband. I told him, well, if there's one specialty I'm not going to choose, that's plastic surgery because that is obscene because everything is on the outside. Like you can see everything. It's not an internal thing. But then at the end, I came back mostly because I wanted to do the reconstructive work. I love soft tissue. I love the skin, the muscles, and function. I'm a very functional person. I wanted to regain function for my patients. And I wasn't so concerned about the aesthetics of it. I was never drawn to aesthetics as a general, as a rule. But then I think maybe into my third or my fourth year in my specialty, I discovered that aesthetics is not as superficial as I thought it to be. It's a very profound subject. It has a lot of different aspects that we don't think about. It's a very strong connection with your patients, and it's not an outside thing. It's more of a body and soul balance that you need to regain. So I never thought of it that way because when you say plastic surgery, everybody thinks, okay, you like silicone implants and duck lips, but that's not it. That is not it. I adore scars. I have to say, I really love scars. It's a passion, but the aesthetics of my patients and the aesthetics as a whole, as a concept of giving you peace of mind. It's a form of art. Never thought of it this way.
Did that realization come rather soon once you started, or was that something that's been developing little by little, year in and year out?
I think it was only when I was at about fourth year of my specialty here. It's a 6 year specialty. It took me a lot of time because at the beginning I was all about function. If you can function, then you're okay. If you cannot function, well, there's a problem. But I think that's why I love my breast reconstructive patients, because I think that they were the ones who taught me that there's more to life than just living. Like it's the taste of your life. It's the color in your life.
Yeah. Yeah. I love these insights. I mean, I think this is what, well, as I was listening to you, I was like, this is what this program is meant to be. Like life as a, is getting these types of insights, because
Yeah,
like, I don't think like somebody who's entertaining this notion of maybe looking into plastic surgery as a profession, as a young person who just doesn't have this level of insight just yet. And how would they, right? I mean, it's not every day that you have a chance to speak or hear somebody such as yourself explain it this way. And, you go into a profession thinking one thing. Once you get into it or you start studying it a little bit more deeply, things change just based off of your interactions
yeah.
with others and the knowledge that you're picking up along the way. And I think like what you've shared thus far is incredibly valuable insights for young people that are interested in this field. So I thank you. But I do have another segment that I'd like to step in here, pathways. And this one, we've already kind of got into it just a few moments earlier. I'd love to hear a little bit more about what drew you into the medical profession as a whole. I mean, even before you got into plastic surgery and whatnot and reconstructive surgery, what pulled you into this field, generally speaking?
Well, growing up, I've always been a nerd. Like I always liked biology and chemistry. I like studying. I still do. But I was also a special kind of ballerina. So I wanted to do something that would be, I thought maybe going into physiotherapy or something like that. And then I remember my mom told me, but you're so smart, go be a doctor.
Mm-hmm.
And I said, okay, I'm an obedient girl.
Yeah.
So I went to med school. In the beginning, I thought maybe I would be a sports doctor or maybe orthopedic surgeon, because for me, I could live in the gym. I adore the gym. I adore the music and everything. And I thought that that would be a good thing for me. And during med school, I was really confused because not everything you enjoy studying, and I do enjoy studying almost everything. Maybe not statistics. I'm not really good in statistics,
I
but
wasn't a big fan of that
all the
one
rest
either.
was okay. Yeah, no, all the rest was pretty. It was pretty cool. So I was distracted by neurology, and I was distracted by OBGYN. I thought this could be nice, and this could be nice, but you don't really know what it's going to be like once you graduate and you go into that profession. So I did a full circle, I think, because I did graduate, and then I started my specialty as an orthopedic surgeon. I thought I would go into sports. I have, you can see I have my degree in sports medicine, very nice on the wall. That's the best use I found for it. I'm not doing it anymore, but I found myself like evolving during the journey, because I started the journey when I was 20, and you are young when you're 20 years old, and you have a lot of aspirations, a lot of things you want to do, but you change and you see life differently. And you get to understand better the meaning of what you do. So initially I thought, well, being a doctor it's a good, it's a good profession. You'll always find work. So something I could do. But then you have to find, I think you do need to go a full circle and find yourself in the end.
Absolutely. And I think that story, sorry to cut you off there. I think that story, it illustrates a powerful learning lesson or learning point that even, professionals such as yourself who have this aim of getting into the medical field, becoming a doctor. I think the perception is that these people know exactly what they want to do. They want to serve people in this capacity, whether it's becoming an orthopedic surgeon. Okay. They're driven, for one. I think that's the perception.
Yeah,
And then two, they have that, just, it's all worked out. But what your story illustrates is, yes, you can have that drive, you can have that desire to do things, but also not exactly know where you're going to ultimately land. And that's okay. Like it can be,
I think it's perfect.
yeah, right?
I think it's perfect. I don't know if you have in mind the song, I think it's called Sunscreen. Always wear sunscreen. Like don't be worried if you don't know what you want to do. Some of the most interesting persons at 40, some of the most interesting person I know still don't. So I think that sums it up because you do need to be driven. That's what I think. But your drive needs to be, if not anything, it should be your own. That's before anything. And you should try always to understand better who you are and what brings joy into your life. Because being a doctor is one, but there are so many kinds of doctors, so many kinds of ways of living. My sister is internal medicine, and she's a family physician. She has a whole different life. She's very different from me, but very different line of work, different hours. And I think ortho was a killer. We worked all day long and all night. A lot of fractures, a lot of accidents, road accidents. Plastic surgery is different. It's different in the hospital where you also treat the road accidents and you treat the burns, the major burns. You treat soldiers, civilians during war. It's very high on adrenaline. But if you are just aesthetic surgery on the private practice, then you have none of that. So even in the same specialty, you always get to choose the way you want to live your profession.
Yeah, I like that. I like this insight here. I've got this other segment too. We could step into a Q&A discovery and continue this back and forth. And one of the things that I've come to understand in researching about this field that you're within and being a plastic surgeon is this blend of certainly science, extreme technical know-how, knowledge, but then also this notion of art. And I have you on record as noting the power of the combination of all these factors and how it can ultimately transform lives. And we kind of touched upon this right at the beginning of the conversation, but maybe you could add on a little bit more to this, because I think this is what really, at least my impression of what distinguishes the work of a plastic surgeon as opposed to maybe some other specialties within medicine.
Yeah, this is one of the things I really love and enjoy about my profession, that every surgery is different, same as every patient is different. It's very difficult if you are more of an engineer type of person. We like to differentiate plastic surgeons into engineers who they prepare everything to the minimal details. They take the angles and they measure everything. And we have the artsy plastic surgeons. They just draw all over the place. They make a lot of mess in the operating room or when they work in the clinic. I myself am I'm a mix, but I'm more of an artsy plastic surgeon. It's I have my plan, but then I have to feel it. So if I'm too engineering, I don't really enjoy my results so much, even it's very precise. It's also a thing that you need to feel. So we as a general plastic surgeons, we enjoy very much music in the operating room. We need to have good vibes in the operating room. Yeah.
Wow.
I really like that. I have to say that the ortho guys also have music, but I may listen to Adele and they would listen to the Rolling Stones or something like that.
Yeah.
But you need to be focused, not only on the medical details, but you need to feel it. I don't know how to explain it, but you need to see where it's going.
Well, yeah, I think that's accounting for that artistic aspect of that work, is because you've got to be channeling something, and you have to be getting yourself into the zone. I do understand what you're saying here.
Yeah, and you do need to get your patient in the zone, because I think that consultation in other specialities may be a lot more easy. Like if you have a special kind of problem, then there's one solution or two solutions, and the solution could be surgical technique, which is that you have to go 1, 2, 3, 4, 5, and the operation is done. Plastic surgery, it's not like that, because even if we do breast reduction, what size do we want to go? How do we want it to look afterwards? You need to feel your patient, and you need to look at your patient, and you need to absolutely feel the vibe of your patient and understand what they're asking you, because sometimes they don't know themselves. So you need to watch the appearance, the way they speak, their style, their lifestyle, and then you can adjust your technique so it would be appropriate for that special kind of patient. And that could be challenging.
Yeah, I would think so. I mean, you're probably gathering some of that in your consultation when you're speaking with them and they're vocalizing
Absolutely.
what they're after. But then also this other side that's kind of interesting to me is the things that you're picking up that maybe they're communicating non-verbally of just who they are as an individual, and trying to like take all
Absolutely.
of this in to be able to come up with an idea or a plan of, ultimately pleasing that person and doing your job well.
And I find that also in the reconstructive section, but mainly in the aesthetic section, because we always say that we are in the I want business. It's not the I need business. It's not a health problem as we are acquainted with. It's another kind of health. It's another kind of health issue. So what they want is more important than what they need, because they don't need.
Right, right. I'd imagine that this would be a bit of a challenge at times, especially for somebody who's just starting out, perhaps, like trying to pick up on all of these
Yeah.
cues and put it together. But what would be some of the other challenges that are inherent to this job, that present some of maybe frustrations to you at times or difficulties?
Well, the whole dexterity in the beginning, that's very challenging, because you need to understand to manage yourself in the operating room, and everything has, you look at the table and everything looks like scissors, but they're not. So that's the beginning of this specialty. And I think there are a lot of challenges, but I think the main one is staying on top of things, because our specialty is changing all the time. There are new techniques and there are new ways of solving problems that we need to stay on top of them. I think that's a challenge. And during residency, I think the main challenge was everything, like keep it together. Keep it together. I had my three kids during residency, so
Wow. Okay.
yeah, yeah, I have a very good husband, I have to say.
Yeah.
He was the one, he was holding up the house while
Yeah.
where's mommy? Mommy's in the hospital. Mommy's in surgery. Mommy, we don't know where mommy is.
Yeah. Yeah. I can imagine that being fairly intense, but you find ways though, don't you?
If there's a will, there's a way.
100%. 100%. There's other question as well. I mean, kind of spoken to this point to a degree, but it'd be interesting, I think, to hear, maybe to compare and contrast the work of a plastic surgeon as opposed to somebody who's practicing a different type of medicine. Certainly there are some big differences. And again, we just touched on them, as far as like this element of art embedded in the work that you do. But what would be some of the other differences? And again, the reason I ask is that I think there could be points where people who are like sold on this idea of getting the medical profession, but they don't necessarily know where they want to go with it. They might have a bit of an interest in plastic surgery, but not enough to go all the way just yet. How would you compare and contrast the work that you're involved in as opposed to some of these other specialities?
Well, it depends a lot on the speciality, because first of all, I would ask myself if I'm an internal doctor or a surgeon. If you are a person who needs immediate gratification, so maybe you are a surgeon. I think that most of us discover that when we enter the operating room for the first time. Either you're excited and feel like you're in the most holy places of all the hospital, or you are disgusted and annoyed. I think that's a start. That's a good way to start. If you're disgusted, then you're in internal medicine. You can do cardiology, nephrology, or you could go so in totally different direction. But if you are a surgeon, or you do really need to do something manually with your hands, then I would ask myself if I really want to be in touch with my patients, and I'll explain, because You could be a very good interventional radiologist. You could be a very good pathologist, but you don't have a direct connection with your patients, or a lot less. You can be an anesthesiologist. You can do a lot of medicine and a lot of dexterity, a lot of manual work. But if you don't enjoy the clinic and the interaction with the patients, maybe that's not the place for you. Either way, I don't believe that there is a better or worse specialty. I think that we are all needed. We are all very much needed. I like working with the oncologists very much. I have to say they're very intelligent and well informed. They have a lot of notions on new clinical trials and drugs and everything. But I can tell you that I never wanted to be a pediatrician because I just can't handle a crying baby. That's too much for me.
Mm-hmm.
I can handle burns. That's okay. But a crying baby, I'm out.
Yeah. You got to draw the line somewhere, huh? Yeah.
Yeah, absolutely.
Yeah.
Absolutely. It's very different. I think that in the year that you're doing rotations in the hospital, it could be a good opportunity to look around you. And one of the things that I did myself was looking at the seniors. Don't look at the residents, because residents, they're exhausted. They look awful. And that's just the way it is. But you need to look at the seniors and try to understand if that's the life that you want for yourself. And I have to say that for me, the surgeons, they were filled with life. They were happy, they were smiling, they were intense, everything's full with adrenaline. And I said, okay, so this is my crowd.
Yeah. Yeah.
I feel good here.
Yeah. That's such an interesting perspective. I think like my impression of when you were initially kind of laying this out was that it comes down to a lot of like self-reflection. You know, when you're going through your studies or
Yeah.
you're making your rounds, you're asking yourself these series of questions, like what drives you, what are the lines in the sand? Okay, I don't want to deal with babies. I can't handle that, but I can do this. A lot of questions to yourself. But that second point that you just
Yeah.
raised, I think, is really interesting. When you are making these rounds, you're looking at others within these departments, and you're looking
The
at them.
system.
Yeah.
Yeah.
And I think that's a really powerful sort of like tip for someone who's maybe about to do this or has already done this, as a way of further evaluating where they might be best suited. Yeah, I think that's really helpful.
It's okay also to change your mind a few years down the line. But if you see yourself doing that, or you want that for yourself, so I think you need to be, it's like a GPS. You need to set your arriving point. So where do you want to go? So if you know where you want to go, you'll find a way to get there.
This last question in this segment here, this is a favorite of mine in terms of asking guests at this program. Love to know how this work rubs off on you. Like when you finish up your work for the day and you go home, in what ways does it like stay with you positively, negatively? I'm not sure, maybe a bit of both at times, but in what ways does it still kind of impact you in your personal life?
Well, that's funny because it mostly impacts me when I'm in bed and I am enjoying my Netflix show. And then I have go and like, oh my God, will somebody please do an upper blepharoplasty on that page, on that actress or actor, or you can just not see
Okay, all
certain
right,
things.
yeah.
Or like, yeah, mostly I have to say that I'm okay with noses. I like noses. I won't suggest a rhinoplasty, but upper and lower blepharoplasty, they're like, oh my God, I cannot unsee that. It bothers me. It hurts my sclera, I always say. So it does rub on you. But I find it kind of funny. It's not really, most of the time I just turn my head off. Like if I meet with a very good friend of mine and then she would go like, oh, you're probably thinking of all the things I need to do with my face. And I'm like, I am not, because I am not working right now. So I don't want to think about you. I'm thinking about myself. So everybody thinks they become very self-conscious when you step in the room. Or sometimes you just want to go to the grocery store and you don't want to go all plastic surgeon. You want to go like 40 something mother of three, really tired. And you find that you also get a little bit too self-conscious about yourself. But it doesn't really bother me. It's not like a bad thing. Normally you just turn off your professional mind, and that's it. I have to say that some of the times what I like about it is that I cannot not see a mole. Like if I see a mole that bugs me, I need to I need to speak it. I need to speak my mind. I have to say, no, I'm sorry. I love you. I know it's an unsolicited advice, but that thing has to go.
Okay.
When it's like that, most of the times I'm right. I have to say it's not very nice,
Yeah,
but
yeah.
yeah,
But fair enough. That's your world, right?
that and sunscreen. Yeah, and sunscreen. My kids know the better than going to the sea without to the beach without sunscreen.
There you go. Well, I do have another segment here, yet another one, a water cooler story segment. And this one where I just ask guest indulged listeners with a story related to their work. And I'd love to hear what you have for us today, Tamar.
That would have to be. I had a very special patient of mine. We met when I was at the beginning of my residency in plastic surgery, and she was one of the first patients I did breast reconstruction for, and we became really friends. She was after chemotherapy, and we did the reconstruction for her, and she came back afterwards for follow-ups, and I was pregnant with my third child. She's a she, or my baby daughter. And I have to say that this woman, I keep seeing her like once a year. Like years have passed, but I keep seeing her. And we went through the reconstruction, and we went through the failure of the reconstruction. We did a nipple reconstruction that went belly up, and like everything was off, everything was wrong, and yet we stayed. I can say friends because we're not friends. I'm her doctor, but I really love her. She's very dear to me, and I think that she taught me a lot. She taught me a lot about this journey. She taught me a lot about how important it is to have that special kind of bond with your doctor. It's not just you. If you have good results, then your patients will love you. Or if you have good results, everything will be okay. If something goes sideways, then you're done. You're done. No, because life happens and things can happen. But that special connection with your doctor, and for me with my patients, it could change the whole experience for me. I have, and every time I come into the clinic and I see these, I now have more than one patient with whom I'm like this, and they really brighten up my day. I come to the clinic and like sometimes I have my assistant, and she goes like, "How come your patients are so cute?" And I always say that I choose them. I just choose them like that. Well, I don't obviously,
Right.
but I do have that special connection with my girls, mostly my girls, but not just girls, also boys. And it's a very sincere connection. It's a love connection. It's a special kind of love connection. And I think that she taught me that. She was the first one, and I always bear her in my mind.
Yeah. Yeah. Well, I think that perspective in taking that with your job, it adds a different level of meaning to it, right? Like in the moment
Yeah,
right now, certainly. But by the sounds of it, this is something that, 10, 20 years down the road, or whenever you're deciding like, okay, enough's enough and you're retiring and you're getting out of this work, these are the types of things that are going to stick with you and again, deliver a
absolutely.
sense of meaningfulness to you later on in life, just as they are right now, maybe even more powerfully later on. So I think that's worth pointing out and it's worth reflecting on right now and the value of it. And I guess as well, like one of the things that struck me when you just shared that is that my impression would be that I don't know, the medical profession sometimes being very stoic and like arm's length away from a patient. Like it's obviously professional, and certainly what you do is professional, but my impression is like, there's no room for this. You're not allowed to have that type of connection with someone, or you
Yeah.
shouldn't, or it's frowned upon. But this is a different perspective on all of it. We're kind of flipping that idea on its head. And I think it's an interesting one.
It is frowned upon. It is frowned upon. I have to say that at the beginning of my surgical career, I was told that I'm too empathetic to be a surgeon. And I was like, what?
Yeah.
How is that even possible?
Yeah.
Like, I'm a doctor.
Yeah, right.
Am I not supposed to be? Like, I remember when someone said that, I just looked at him and I was like, come again?
Yeah, yeah.
But I do think that is one of the differences in the surgical field that is brought by the large scale of female surgeons. That is now just the numbers are going up, because in the past it was predominantly a male atmosphere. If you are in the operating room, you must be the scrub nurse. And today it's not like that anymore in most of the specialities. And I don't think that women do it better. I think that women do it differently, and we do it with our hearts. Most of us. There are also men who do it with their hearts, and there are women who are very stoic and not attached emotionally. But I think that in the end, you have to bring yourself. And if you are a people's person, I need to feel. I'm very emotional, and I need to feel my patients. I need to talk to them, and I want to do good for them. I want to do right by them, and I want good for them. So I have to know them. I cannot not attach myself to them. I think it's a notion that's changing. That notion of the white coat,
right,
and
a little bit more cold and detached.
Yeah,
yeah.
I think it's also more paternal. Like, you have a paternal attitude about your patients. I will tell you what you need, and I will tell you what to do, and I know better than you. I think that belongs in the past, I have to say. But everybody gets to do what they think.
Yeah, it's encouraging to hear that it is changing, though. And like you said, with more women advancing within the profession, the impact that's having to help create this shift, I suppose. And and yeah, it's I think the other point that you raised there too is that as a professional, we often put our stamp on the work that we do, and bringing who you are and your personality into your work, in theory, is only going to allow you to do it better, as long as it's
Exactly.
right. So I think that's a big point as well. And I think it's encouraging to hear that field is now maybe opening up a little bit more to allow that to occur. Because I think, again, the perception might be that could be one of the last vestiges where that isn't necessarily occurring, at least from an outsider's perspective. But yeah, it's, like I said, encouraging.
It's changing.
Good.
It's changing.
Good. Well, we are rounding the bend into the last few questions here. And this last segment here, our crystal ball segment, we're looking towards the future, trends, predictions, so on and so forth. And typically here, we're looking at like technology, and oftentimes nowadays it's AI, and how that is shifting and changing things around within the guest profession. I'd be curious to hear a little bit about that for you. I mean, different tools that you might be leveraging tech-wise that are making your job a little bit less complicated, or maybe a little bit easier, or maybe it's the opposite. Maybe it's adding a different layer of complication to it all. I'd love to hear.
I think that our world is shifting. The plastic surgery world is shifting towards minimal invasive techniques and technologies. The technologies that allows us to have smaller surgeries, or I would not say replace surgeries, because when you need surgery, you need surgery. But there's a lot of in between. There's a lot of people that come in the gap between conservative treatment and surgical treatment. And in that gap, I think that technology is advancing really, really fast. And we need to pick up on that. But I do believe that a lot of technologies like radio frequencies and high focused ultrasound can really, really, really help us get better results for our patients. Get, like, the person that will be able to come out with the real scarless facelift will be a billionaire because you cannot get a facelift without a facelift. You cannot. You could get your face filled, but we're working on that. So the advances, I think, in technology will go versus that aspect. But I have to say that AI wise, I know there are now AI tools that will tell you how you would look if you have this procedure or that, if you have your temples filled, but I don't think that they can, it's not there yet, but I don't think they can really replace the human connection because I could step into that AI, open the app and go like, okay, so what do I need? But they don't know what I want.
Yeah.
So they would get a lot of different options, but they could not consult me on what I really want. So I'm not bothered by that. But maybe someday they will be able to get to you better
Yeah.
as a person would.
Yeah. It's full circle, like what we started off this conversation by, exploring a little bit, like getting to know that person, the verbals, the nonverbals, and putting all of that together to be able to come up with a plan. It's something I'd like to add in as well. I mean, I don't know when it was, but I think I saw news of like an app that was using AI to scan like imagery of like lesions or moles on people's skin to be able to identify potential risks of skin cancer. I'd be curious whether it's something like that or some of these apps that you were just speaking of, maybe where people can like say, okay, I here's a picture of myself. This is what I want to do with this and that. Are people coming into your offices now with apps and saying like, well, this is what I found here, or this is what I'd like to do? Or is this a thing yet, or is this just?
Well, they come with Instagram filters.
Okay. All right.
I have to say, yeah. And sometimes I spy on my patients, like my regular patient. I don't really spy on them, but if we are friends on social media, sometimes I look at them and I was like, I did not do that lip. That's not my lip. And then I said, oh, okay. Oh, that's a filter. And they do come with a filter and they say, I want nose like this, but it's not. That's why I don't do imaging of let's see how it would be after surgery or after, because it's not very accurate. And I think that it's a problem that you create like a very, very precise expectation in
it's an
your
impossible
patient's
expectation,
mind.
probably, right?
Exactly. But I do like them to show me their favorite filter because it's like telltale. Because if they normally what we do when we take pictures, we go like this on the side with the lips. So that already tells me that my patient would want her cheeks to be more pronounced, maybe jawline. So I do like to spy on them on social media because I can understand what they want. But I don't like if someone comes in and tells me I want I don't know this very specific type of nose, and I would say I'm not your person. I'm sorry.
Got it.
We're people. We're not machines.
That's right. That's right. One last question here. I know I've taken quite a
Yeah.
bit of your time here, and I know you've already spoken to this point in different ways. And it's centered on any direct advice that you'd be giving to somebody who is sold on this field. Like, this is what I want to do. I want to get into plastic surgery. Do you have any direct advice to somebody like that?
Just do it. It's considered very high specialty, very difficult to get in the residency to get a spot. Don't let anyone tell you what you can or cannot do. If you want to do it, just go and do it. That's it.
Short and sweet.
Yeah.
I like it. All right. Well, it's been a true pleasure. I mean, we've just blown through this conversation, and I know listeners are absolutely going to love it. So once again, thanks for all your time and insights. It's been a true pleasure.
Thank you.
Now, for those interested in learning more about Dr. Halperin Ben Ami and her work, you can do so via LinkedIn. And for reference, I will have a link for this within the show notes. And hey, I mean, if you like today's show, please be sure to tell a friend and share. To show further support, you can always rate, review, and subscribe wherever you access your podcasts. And then lastly, as I mentioned off the top, head on over to YouTube. I do have that channel which hosts video highlights from these conversations. And if you do make it over there, would love that like, subscribe, or even comment. And finally, don't forget to join us on the next episode of Life as a You could literally be one listen away from finding your dream job. I'm Christopher Schoenwald, your host, and until next time, don't settle for less. Find the career you were born for.